So the other day I was reading about the Great Plague back in the day, as you do when you're in your mid-30s, it's winter and past 6 p.m. And it got me wondering, how did COVID stack up compared to that? Because after the vaccine started working, we all got out of lockdown, everything went back to normal, we weren't being told the figures anymore. Mostly because no one wanted to hear about it anymore. But it's been a while and now I'm curious. Before we begin, we post death and dying related videos every Friday, so if that sounds like your kind of thing, consider subscribing to the channel. Now let's talk how COVID compared to other pandemics. Now how you go about comparing the death toll of this kind of thing isn't as easy as just lining up the figures, because there is the basic number and there is the percentage of the population. Different countries had different population sizes, as did different times throughout history. But first, let's look at the basic numbers that came out of COVID. So COVID was first detected in Wuhan, China in late 2019, and it hit Australian shores on the 25th of January 2020. And as of June 2024, according to the World Health Organization, the worldwide death toll from COVID stands at 7,051,323 and is still increasing by about 300 deaths per week. Now to break down that number, let's see how various countries did. And we're going to go on pure numbers, not percentage here. The USA by far came off the worst with 1.2 million dead. Now, yes, they have a big population, but other highly populated countries like India had about half that. But on the other hand, the World Health Organization is working with the figures that were reported to them, and those reports come from each country's government. For some countries, North Korea for example, lying about figures and saying they were at miracle level lows is about ego and pride. But for other countries like India, their government was trying to provide accurate figures, but with such a large population and huge rural areas that aren't very educated, a lot of deaths just weren't reported to government authorities by local communities. Thus, India's numbers are mostly made up by those who died in hospitals. So you can see how working out the actual figures is difficult. So with all that in mind, these are the official figures that we have. USA, 1.2 million dead. Brazil, 702,000. India, 534,000. Russia, 403,000. Mexico, 335,000. Some other interesting numbers to note was that Australia had 24,414 dead, and Iran, who if you remember at the very beginning of COVID took a massive hit that was widely reported on, ended up totaling 147,000 deaths. Now, countries who reported no deaths included North Korea and Turkmenistan, both of which surprised no one as they are run by dictators who will tell the world everything is great over there. Though in saying that, the US and other countries did fly camera drones over North Korea at various points during the pandemic to assess what it was really like, and they didn't find any evidence of mass graves that would have been easily spotted. And no country with high numbers was able to keep up with the cremations during that time. So this is an interesting observation. We don't know what happened there. All round, the actual COVID death toll is probably a lot higher than we know. And this shows the problems in working out these kind of things now and throughout history. So all round, even looking at it that simply, those are some big numbers. But pandemics are nothing new. And what we lived through, while it sucked, really wasn't anything particularly special as far as human history goes. So how did it compare to previous pandemics? The Black Death. The Black Death was the plague, but not the only plague, let's make that clear. The plague has been coming and going throughout human history, and it continues today with at least 1,000 to 2,000 cases every year. But the term the Black Death describes the flare-up of the bubonic plague that occurred between 1334 and 1353 throughout Asia and Europe. Asia being the first half of those dates and Europe copying it the second half. This is the plague that we hear about that killed half of Europe. In total, around the world, the Black Death killed around 75 million people, over 10 times the amount that COVID did. And keep in mind, the world population back then was a lot smaller, so percentage-wise, it's a lot worse. Nowadays, plague can be treated with antibiotics, although there are starting to be a few antibiotic-resistant cases, which is concerning. But back then, medicine wasn't what it is today, but they did the best with what they knew. and they did quarantine. They knew they had to stay away from each other, just like we did during COVID. And without anything medical to stop it, they just had to wait it out. Can you imagine having to wait out COVID and isolate for 10 years while everyone dropped dead? Spanish flu. I call it the Spanish flu because that's what everyone knows it as, but much like we don't call COVID the Chinese virus, calling it the Spanish flu isn't particularly great either. It's also called the Purple Death, the 1918 flu, or the Great Influenza Pandemic, which is more appropriate, especially considering it didn't start in Spain in the first place. Actually, the first case was located in Kansas, USA of all places, in March 1918, and by April it was noted in France, UK and Germany, which was very bad because we were in the middle of a war. Okay, we were kind of near the end of World War I, but what was going on, so quarantining while you're invading other countries just wasn't going to happen. Now, if you are wondering why it's called the Spanish flu, when it broke out near the end of World War I, wartime censorship in hostile countries suppressed any bad news in their countries to maintain morale, so newspapers weren't able to report freely on much. But Spain was neutral, and when a small outbreak occurred there, the newspapers ran with it, creating a false impression of Spain as the epicenter of the outbreak. So with all that said, the 1980 flu killed somewhere between 25 and 50 million people. As you can imagine though, keeping medical records and working out who died one way or the other was a tad difficult during war while everyone's getting blown up. Though it is said that more US soldiers died of the flu during World War I than during battle, which, considering how battles were fought back then, does make for a scary thought. Again, there were no vaccines back then, so how did it stop? Well, firstly, the war ended and everyone stopped moving around the world. But mostly, by the time summer of 1919 rolled around, all those who were infected were either dead or developed immunity. And that's evolution for you. New World smallpox. Smallpox has been around for at least 4,000 years, and it had been in many parts of the world for centuries before this outbreak. But it wasn't until Europeans landed on both North and South American shores that shit really hit the fan, with between 25 and 56 million people dying between 1520 and the early 1600s. It wiped out 90% of the indigenous populations across 2 continents, which certainly made European colonization easier. It is thought that when it was in Europe, smallpox would kill 20 to 60% of those infected with it, depending on the area. And if you lived, you developed a certain amount of immunity. But no one in the Americas had any immunity, so the first wave of smallpox just took everyone out. The smallpox vaccine, created by Edward Jenner in 1796, was the first successful vaccine for anything to be developed. The World Health Organization launched an intensified plan to eradicate smallpox in 1967 with widespread immunization and surveillance conducted around the world for several years. The last known natural case was in Somalia in 1977. In 1980, World Health Organization declared smallpox eradicated, the only infectious disease to have ever achieved that distinction. This remains among the most notable and profound public health successes in history. Plague of Janian. An early version of the bubonic plague, this one was during 541 and 549 AD. It spread across continents, reaching Roman Egypt, the Mediterranean, Northern Europe and the Arabian Peninsula, killing 30 to 50 million people. And that is a massive figure considering the time period and its limited population. Not much to say about this one because not much is known, but one interesting fact is that many historians regard the plague of Janian as the dividing line between the late antiquity period and the beginning of the Middle Ages. HIV/AIDS. Last one for this list. Many people don't see HIV as a pandemic, perhaps because there was not a lot of coughing, we didn't quarantine, and it's a lot harder to be infected by this one than the other things already mentioned. But let's remember that a pandemic is defined as a widespread occurrence of an infectious disease over a whole country or the world at a particular time. So yes, it absolutely is. So the HIV virus is believed to have first crossed over from chimpanzees to humans in what is now the Democratic Republic of Congo via blood contact around 1920. It spread more or less undetected until 1981, when a particular type of pneumonia and rare cancer called Kaposia sarcoma started to be reported heavily in previously healthy gay men in the US. By the year's end, there were 270 reported cases and 121 of them had already died. It is believed, though, that by this point, HIV had spread across 5 continents. By 1987, when the World Health Organization launched the global program on AIDS, an estimated 5 to 10 million people worldwide were living with HIV. Today, it is estimated that more than 2/3 of those living with the virus live in sub-Saharan Africa. To date, HIV/AIDS is believed to have killed more than 45 million people around the world. While we don't yet have a medical treatment to cure HIV, we do have very solid treatment methods to deal with it and ensure that those taking the medication will live long, healthy lives despite their diagnosis. We also have solid oral medication that prevents HIV in people at risk of infection with the virus, which, if taken as prescribed, is said to be 99% effective. So yes, COVID was bad. Over 7 million people died. But a vaccine was created, and within 2 years, we were able to get on with our lives. It is nowhere near the worst pandemic humans have ever lived through. Remember those initial days, the mass graves and refrigerated trucks? Even though it didn't feel good and looked chaotic, the world did pretty damn well to handle it. Yes, hospitals had a very hard time with it. But naturally, they were prepared for a local emergency, not the whole world crashing kind of deal. Perhaps us as humans got complacent about our place in the world. Medical staff were fighting against the natural biological world that rightly should have taken out many more of us. So yes, it was hell, and the trauma those nurses suffered from what they saw is going to take a long time to heal. But they were fighting against something much bigger than us. There is certain thinking that diseases are the natural world's way of keeping populations of any species in check. Darwin's survival of the fittest in order to keep the healthy population strong. So it could be said they were fighting evolution. They managed to keep many of those who were unhealthy before the pandemic alive when they caught it. They managed to keep alive those who flat out refused to quarantine or get vaccinated alive. Because, for better or worse, with modern medicine, everyone must live. Let me know what you think about all this in the comments. And with that, go talk death.